we have clients specifically in integrated pain where we are offering solutions to the providers to identify risks for the opioids and then offer services other than going into med management. This is Mehmet Kazgan, and we are an end-to-end solution for patient engagement. We started because I wanted to build a vision around making data available for physicians and clinicians when they need it, for the patients when they make informed decisions with their care. I worked in payer world. I was an executive in Aetna. So I wanted to see if I can make a dent on healthcare by enabling that data for the providers, removing all the administrative inefficiencies for them. When you're part of a clinic or a hospital, when you have a visit scheduled, they get a text message, they download the application, and the moment they are interacting with the application, they're connected to the electronic medical record. So cliexa will know immediately if this is a new patient, follow-up patient. We do the cross-checks, collect data from different data sources. We are EMR and device agnostic. We collect information depending on the risk models that providers provide services, how they identify patients' risk models, how they're going to treat them. So we paint that picture within seconds as we bidirectionally talk to the electronic medical records, but also health information exchange data. We put that into the EMR, but as well as that, we also put that information as where they fit, like progress notes or assessment information. That will also qualify the reimbursements and their compliance and quality measures as well. I think the biggest one is the cardiovascular sector. We are invested and partnered, co-developed by American College of Cardiology. So we have been working with them since 2018. They've been guiding us building clinical algorithms on a monitoring basis, specifically how, as you know, the remote patient monitoring platforms today focus on single comorbidity and also device data to qualify the visits. We are actually building an additional layer on it where we collect information and we ask certain questions on a mobile basis to qualify risky information, medical device information, basically qualifying and validating that information to really build an accurate risk assessment and the flows that are triggered, push that information in an RPM basis, but trigger flows in an automated fashion with the EMRs. Our biggest goal is really scale what we did, kind of like we're at the phase of we did the product market fit. I think the platform is looking much better, so we can repeat quickly and scale the business. We're looking to scale as much as we can. We have 3 major health system contracts so that we can build more platform-based solutions. We serve and start with only single subspecialty. So in hospital systems and big health systems, we can offer additional solutions, especially comorbidities like monitoring cardiovascular with diabetes or pain with mental health. So this year it's going to be more scaling our solutions into bigger health systems, but also offer the solutions in small to mid-sized clinics, which is a faster kind of sales process and procurement for us. The important use case is focusing on like a holistic approach in pain management. So we have clients specifically in integrated pain where we are offering solutions to the providers to identify risks for the opioids and then offer services other than going into med management. So it's really important for med management with an opioid risk with the patients, because if they're a chronic pain patient, that means they've been using opioids for a while. So instead of offering patients the med management, they offer other ancillary services like physical therapy, coping skills, mental health therapy, injections in some point. So majority of the patients in those clinics started to see a decline in their med management in an opioids they're using because they were offering different services with their risk model, which we were pulling out. And we also give the opportunity for the providers and the health systems to be able to monitor the performance of identifying risk and what ancillary services is one thing we do, but we also monitor if the providers are compliant to their own protocols. So we can compare what they're eligible, how the protocols are driven, but we also track the outcome so they will have the ability to see if they're following their own protocol properly. That also affects reimbursements, their quality and compliance, even like MIPS reporting as well. So we have seen specifically those clinics and their patients starting to use less opioids, which is a great target from clinical angle. And for the providers, not only clinical quality is going up, their rejections and denials are going down because they're offering other services with justification up front within the EMR, as we are making their life more efficient on administrative cases.
Amazing. Thank you so much.
Thank you.